Can you hear me online now? If Katrina, if you just want to give me a thumbs up or tell me that you can hear me, that'd be great. Oh, okay. Yeah, all right. Thank you. Fantastic. All right. Well, it's really great that you're all here today to join us to talk a little bit about what Flinders is all about and what to expect from the Masters of Public Health program. So a really warm welcome to you all. Always want to stop and reflect that we are coming to you from Ghana country. And I would like to acknowledge the traditional owners and custodians of this land on which we're located, and also acknowledge that Flinders extends all the way to the very top and is working with the traditional owners and custodians of the lands of the Arente, Dagamon, and all the way up through to the Yolno peoples. So we are really blessed to have that kind of reach and to have that impact of working with Aboriginal and Torres Strait Islander people in our work together in public health. So here we are thinking about getting our essentials sorted about how to begin and be successful in the program. Always good to be here to listen and to learn, as well as we listen and learn to you as well from your experiences. So one of the ways to start listening and learning is by connecting. So thinking about the network is the free network that you can link on to whenever you're here or working outside of the campus is EduRoam. So click on that to connect, and then you'll have to have your FAN, which is like the last four digits of your well, it is coming from your name, plus four numbers as well. And then you'll create a password. This is sort of your key to almost everything here at Flinders. The first thing you do is get your FAN. I had to do that when I first came. I'm like, what's a FAN? There you go. If you need more information, there's that link on the slide. All these slides will be made available to you on our Masters of Public Health course site, which many of you might have already seen, and that will be useful to you. So for new students, I'm sure you have 1,000 questions. Good place to start is the new student section of Compass, which is the site for new students. If you have any questions, ask for support with flinders.edu.au/ask, or Ask Flinders as well works. Flinders Connect is also a really good place to get general inquiries sorted out, and there's a number there. After your FAN, another thing you need to be doing is to get your ID card, because your ID card is a way to, be able to. Completely forgot, Liz. What does the ID do?
Printing, borrowing from the library, and if you're eligible for student concessions.
That's right. And I remember as a graduate student, printing was really important to me. So if printing is really important to you, then your ID card is the way to go. But it's also really important to have for lots of different reasons. Okay, so enrolling and registering. So important to enroll so that you know what your timetable will be and to be giving us an understanding of who's going to be in our classes so we can reach out and support you. So enroll in your topics, log into your student system, select your enrollment tab and agree to the little declaration. Scroll down to see the topics that are available to your course, place a check next to those topics, and save. I think the biggest part of step one is saving your changes. Step two is to register. So you enroll, but then you have to register. So log into the student system, select the timetable, and select your study period. Some of the classes and the graduate side of things will have multiple tutorials to choose from. So that's what you'll be needing to do there. select change or register for each topic. Click on to select the class. I think that's the green button. That's right. And then select save. You want to save your changes. All right, so get familiar with your learning environment. Part of your learning environment will be in class, but another part is kind of more of the digital end of things. So Flinders Learning Online, which is commonly referred to as FLOW, is our learning management system. We currently have changed vendors, I would guess, in terms of who delivers that learning management system. And our new one is called Canvas. So you might hear Canvas or Flow, but they really are working together, part of the same thing. So for access, go to canvas.flinders.edu.au. Your course sites will be the center of your learning for that topic. I mean, your topic sites in Canvas will be the center of your learning. So all that you'll need to know in terms of your resources, in terms of the lecture content will be there. Super important. To find out more, register for one of our Intro to Flow and textbook sessions. Most of our courses will have online content. We try to restrict textbooks, but I can't say that across the board. But I think it's really a great idea for you to take a look into those workshops, because you have to kind of know your way around so you get comfortable with that, so you can find out everything that you need to know there. Okay, transport. So we've got a lot of different ways of getting here. Parking, lots of parking around campus, but you'll need a parking permit. Which you can apply for at flinders.edu.au/parking. The bus, I take the bus a lot, comes from Registry Road right here and drops off at Flinders Medical Center, University Drive, and then off, right? Adelaide Metro gives you a good idea of when the next bus will be coming, you know, the website of Adelaide Metro. But also they're listed. I found this out kind of late. They're listed real-time information right there outside of the bus stop on your way over, which is great. 40 minutes to the CBD. The train is 22 minutes to the CBD, and there's ways to hop onto the white bus to get down to the train station. Train station is beautiful. It's new. It's got a coffee shop. It's got parking. And that loop bus, the free bus service that takes you around the different campuses here, different parts of the campus here at Flinders. Scholarships. So there's a range of scholarships available. So go to that website to find out. It's not necessarily linked to academic merit. So if you are interested in various different kinds of scholarships, go take a look there and see if you can get that support. Okay, safety, super important topic. We expect that everyone will have a safe and respectful experience here at Flinders. Should you have an experience that is not a safe one or a respectful one, you can please contact Safety on Campus, flinders.edu.au, to make a report. But that report does not necessarily, it is not a complaint. But it will give you an opportunity to go take that next step if you need to. I can imagine that would be a tough thing to do, but if you feel as though you'd like to raise awareness about that, this is a really good thing to make us aware so that we know how we can make some changes, right? So we have lots of services that are focused on student experience and health, and to create the most successful environment for you for your studies. Some of these are the health, counseling, and disability services. You can add our services. You can see a doctor or a nurse, or chat with a counselor, talk with a disability advisor about studying with a health or with a mental health condition. and access self-help resources. So I have a little bit here. So a disability could be like a medical condition, a mental health condition, learning difficulty, ADHD, or any disability that impacts on study. So it's pretty wide. So if you feel like that might apply to you, don't hesitate. Go talk to a disability advisor, and they'll set you up with a disability access plan that's anonymous, so that you'd be able to have an opportunity to talk to your topic coordinator and say, I have a plan, just to let you know, and you might be able to have some accommodation for you in terms of due dates and things like that. Also, lots of resources for you to find support throughout your time in this semester. So I was really excited when I found out that there was an OASIS here in Flinders. OASIS is a student well-being center. Now, I teach health promotion, so anything to deal with well-being makes me pretty excited. So OASIS is really there to create the best lived experience here for you as a student. It's located, you go through the student hub. So you go past Grind and Press and you go through the student hub, take a left and go up the stairs outside where the big screen is, and then hike a little bit right and then through this breezeway, and it's over there on your left. It is an oasis. It looks very inviting. There is open spaces to lounge, to find a quiet space. There is kitchen facilities, prayer rooms, a courtyard garden, and book table for events and such. So there's a lot of things that they also offer. They have conversation groups, volunteer programs, mental fitness and workshop and communities, chaplaincy, mindfulness, and lots of different things just to sort of help break up your, if you're feeling stuck in a particular way. Sometimes I just need to do something different. This is a great place to find something different to do, to get a new perspective. Yeah. There's also the International Student Services. So how many of us many of you may be international students. So there are a range of services for you. Lots of questions that you might have. These guys, this group of folk are really good, very knowledgeable, and a safe place for you to ask your questions. They will share information that you need, discuss confidential matters, lots of different things we have going on for internationals. Meet and greet service. For those who are coming in, obviously you're already here, but for those who are coming in, they actually go and meet you at the airport. I thought that was pretty cool. Yes, so social and fun activities, and to connect you with other support services as well. So Eduardo from International Student Services will be coming in a little bit, and he'll be speaking to you a little bit more in depth about International Student Services, and he'll hang around as well if you have any questions. And that's his slide for that. So I'll hold off on that for a moment. You have any questions so far? I just feel like I'm just talking. Always makes me nervous when I do that. Right, so again, more services for students. I mentioned that there were prayer rooms and conversation groups, but one of the best things that are going on that's fairly new is the student success and well-being advisors. So this is, we have Melissa Suckley, who's going to be coming in a few minutes to talk a little bit about what she does and to help you as well, because she works for us in the College of Medicine and Public Health. There's also the Pride Network and Good Vibes Experiment and Equal Opportunity Advisors and lots of things going on. can imagine that it's a busy place, and ways to get involved are multiple. And that's Melissa's slide, and she'll come and talk to you a little bit about that later. We have Kelly, so I'm going to introduce Student Administration Services, or what we call SAS, very sassy. And Kelly's going to have a chat with you about what they do.
And have a break from speaking. Hi everyone, my name is Kelly. Together with Tess, we provide the services of course advice within the college. Up the back when you came in, and I've got to admit that the rest of the team hate me doing this to them, but I'm going to do it anyway. Taryn, give everyone a wave. Taryn's part of the team as well. We have a team of 30 that sit inside the college office, and we're located inside Flinders Medical Centre. We are very, very passionate, and I'm just going to do this lovely person a favour because I'm sure they don't want to be seen on the recording for the rest of the slides. We provide a service inside the college to all courses within the College of Medicine and Public Health. We are very, very passionate at with what we do and the service that we provide, and we love speaking to students. So if you happen to be down in Flinders Medical Centre and just outside the Gus Frankel Library, drop by, say hello. Taryn sometimes sits out the front, sometimes I do it. We all take turns. Our college manager sits out there sometimes as well. So you never know who you'll get when you come past. It's also worth noting that that is a place to go if you can't find what you need. So if you happen to be in that area, that's a place to stop. Don't traipse all the way up to the hub to ask a question when you're already down there. You might not need to go all that way. Vice versa, don't come all the way down if you can stop up at Flinders Connect. I'm looking at my friend up the back who I met the other day. A poor guy traipsed all the way down, 30-something degree heat. It's, you know, there's a lot of ground to cover, and there's many points along the way that you can stop and ask for assistance. And that's with timetabling, assessment, course advice. If you want to speak to a course coordinator, topic coordinator, we've got the wheel team inside the office, so that's for placements. So please, please don't try and work it out yourself, especially if you're struggling to find anything online. So this will give you all of our information. We're there from 9 till 5, Monday to Friday. We have our own email address, a direct phone number to the office, and we also take a lot of requests through Ask Flinders. When you do go through that way, please, please, please provide as much detail as possible. So email and Ask Flinders if you put your student ID, your name, the course you're studying. That would help us because we do cover a lot of areas, and be very specific about your inquiry. So yesterday or the day before, I got an inquiry that just said new study plan. And I was like, okay, so do you want 2 topics a semester? You're changing degrees. So if you provide us a lot of information, we will give you the same in return. What have I not covered? I think I've covered everything. I'm sorry, I can't talk much. Oh, well, I can talk about a lot of things. But oh, when you do come down to the hospital, sometimes you'll see dogs getting around the volunteers in the hospital. We've got them coming past quite often. They drop into the library as well. Please go up and say hello, have a pat. It's good for the serotonin. And I saw a pony. I have to tell you, yeah, that was the other day. I was yesterday going into the car park. There's a therapy pony. It's a little pony. It's got pink all over it. It's got love hearts on its hind. It is adorable. If you see that, you have to pat that too. That's what I'm letting you know. And there's a lovely duck pond in the hospital, not just up on the hub. So get around, explore. This is your new home. So make the most of it. I'm going to go now. Bye.
It is a beautiful campus that I'm still exploring as well. The lakes over here in back of our building there, the North Ridge, yeah, is a beautiful walkway. That's one of the ways that I go to reset as well. Thank you, Kelly, so much for all of that. Kelly is a good friend to us, staff as well, for our questions. And as course coordinators, we are here for you to help also. So don't forget to ask me. And some of you have already done that. great to see all those folks that I've already been talking with. All right. I wanted to talk a little bit about the Flinders Student Association. So FUSA, you know, is what they like to be called. They are all about student support, student representation, and student voice. My colleague and friend Kate Walsh spearheads FUSA and is really positions herself as an to advocate or help students to manage that space between study and us. So that's where student voice comes into play, and really thinking about what do students need and how can we help students get what they need, whether it's counseling, student support, financial support, as well as advocacy for thinking about needing remarks or resubmissions, grade appeals, those kinds of things. To manage that, you can go to FUSA as well and get some advice. But student voice is a really big idea that I'd like to put forward to you. You have a voice here at Flinders. It's not just all about the researchers or the educators or the admin. It's you. You are Flinders. And we would like to hear from you so that we can do our work better, right? And part of that is representation. So what does this mean? This means that we have two ways to be involved with representation. We can have a course we would like to invite course representatives into the Masters of Public Health and also the Bachelors of Public Health. And the EOIs, the expressions of interest, are on this website to take a look if you're interested in representing student experience, student voice at the course level. They also have topic representatives. So like within the topic I teach in health promotion, hopefully I'll have somebody who puts their hand up and said, I would like to be the student voice for that course. And so that's one topic, sorry. So that's when topic coordinators as course topic representatives, as course representatives also do. They listen to students and their needs, and then they bring them back to us, right? Not everyone wants to have a chat with us about things, especially if they have something that kind of is concern, right? So anyway, so this is a really great opportunity for you to exercise your voice and to build leadership skills as well. So there's more about that on the website because there's training for both going forward, and so you're not alone. I hope that you really get that idea. You're a student here. You are not alone. Yeah. So make the most of orientation. How do we do that? One of the good ways to start doing that is by finding your ways at Flinders. So all you have to do is type that in, search for Finding Your Way at Flinders, and you'll be able to find some skills that you might need, some handy tricks of the trade, and some videos to help you navigate through the systems, the variety of systems we have for you here, as well as the different kinds of support services, as well as libraries and all that good stuff. So I encourage you to do that. Who has done that? Has anyone started with that finding? Ah, excellent. One has started. That's wonderful. Okay. So this is orientation week, the big week. And I hope that you're going to be able to find your way through it and to get as much information and find some new friends along the way. So what's going on in O week? We have the Welcome Hub, which is past Grind and Press, and that hub down where a lair and a couple of different kinds of food opportunities are there for you. But on that ground level, there'll be lots of people there offering information about clubs and other things going on. Campus tours, I probably should take one of those, I think. There's ready to go sessions and intro to flow and textbooks that I mentioned earlier, social events, and clubs. So clubs are really something that you could find out when you go to the hub and see what's going on. There's fair days as well. We have career fairs and other kinds of fairs with industry coming in from time to time. be on the lookout for those, especially in public health. That might be one way to get linked in to some of your interests and help guide your study in that way. And then it's not over yet. We have Connect Week, which is the following week, first week of classes. And so what is Connect Week all about? Boy, it's similar to O Week, but a little bit more focusing in on connecting you to other people, other students. So there's quiz night, comedy shows, picnics, meditation and conversation, kind of just going deeper and building your network. Okay, so this is super important. Key dates. So what do they all mean? So we just went through the 19th to the 23rd. O Week, that's now. Next week, classes start. That's a pretty big, important date. We have Connect Week as well. March 8th is not only International Women's Day, want to flag that, very important, but it's also the last day to enroll in topics. So that's important for you to know. On the 29th is another really important date. This is called Census Day. This is when we count who's going to be in the course for the rest of the semester. This is the last day to drop your course without a contribution to financial contribution, AKA lay penalty, like as in money for that topic. May 10th is your last day to withdraw without a failure, which means an F for your mark. So those are really important dates for you to think about. There's some other top tips that we have for you. We've mentioned Canvas to really get familiar with that learning management system that you'll be using, but also keep an eye out for Ping. And Ping is, who's heard of Ping? Yeah. Oh, so and you're clapping, so that's a good sign. So all right. So Ping is a university-wide newsletter, and it's an information portal to kind of reduce the amount of emails you get from all of us. So be on the lookout for that to kind of get information that staff want you to know, yeah, so that will be useful to you. We have social media. Hey at Flinders, Ask Flinders on Instagram and Facebook. And then again, I bolded this. Join the Flinders University Student Association. They can be found in the hub. And don't be afraid to ask for help from anyone, especially Kelly. Kelly is the source of truth for all things academic in terms of topics and study plans, and they really talk a lot with us, and we go back and forth. So, you can ask for help from other students as well, but it's really best to kind of get it from the source of truth. Okay. So, and seek help if you need. There's another website for you there. All right. I'm going to be a little bit of a segue here. It's 3:30. That's what I thought it would be. That's pretty good. Okay, this is when we talk about our program, the MPH program. And I'm going to stop talking for a moment and get you guys to talk. Oh my God. If anyone takes my class, that's what you'll be doing a lot more of. But so I want you to, what do we talk about when we talk about public health? So what I want you guys to do is talk to a neighbor and yeah, introduce yourself and tell them why you're here. Why are you studying public health? Listen in and then tell your story. So do that for just a few minutes. Okie dokie. I think it's time to pull it back. So I hope you've heard some really great stories about why you're here studying public health. I find that it's one of those things that we have multiple different kinds of experiences and that inform why we've made this choice. So it's always good to be enlightened in that way. So, you know, public health, you'll hear this over and over, and many of you may already be working in this field. But, you know, what drew me to public health is that it's both the art and the science of preventing disease, prolonging life and promoting health and well-being, right? Which is the WHO's definition, right? Why is it the art and science? So you've got the science, right? Or how we know what we know by measuring people's health, by thinking about the big data that informs policy and decisions going down to help prevent disease and injury. However, not when we go into the world to support population health, not everyone thinks of health in the same way. And not everyone has everyone has different understandings of what well-being looks like. So it is an art and a science together. So that's really pretty exciting to me. Also, public health really is very contextual. So yes, we have the science, and yes, it is an art, but we have to think about the structural, social, political, commercial, the broader determinants of health that impact and shape how we experience health and well-being, where we are located, whether it's in a city or whether it's in we're in a rural context. All of these things come to bear, and so this will be part of your study as well. One key metaphor for public health, I just wanted to put it out there for you to kind of stick this in your head. Who's heard about the upstream downstream approach to public health? I find this to be a very not popular, but very powerful metaphor, because it really helps to sort of think about where public health happens. So upstream at the top of the slide, we've got, you know, education, we've got policy, we've got economic structures, right? That some of those determinants of health I was just talking about. But one of the things that happens is that even if you have some of those things going for you, and maybe you don't have some of those things going for you, but there might be you know, as you lean over to take a look at the river, there might be some kind of break in the fence there that you fall in, right? What's keeping you from falling in, right? And what are the factors that create the holes in the safety net that support you falling into that river, and then coming down to where to the tertiary end of things, where the downstream, where we take care of you. But we don't want to keep on just taking care of people. We want to be able to be focused on prevention, of fixing up those fences so that people stay out of the river to begin with. A lot more to be said on that, but I just wanted to stick that in your head for you to think on. So what can you expect from your courses and from your research? Student-centered learning, active engagement with topics and with the material, developing learning communities in your classroom. You are not alone in your learning. We learn best from each other, which is one of the reasons why I had that little chat for a little bit. We have a variety of teaching formats to suit a variety of learning styles and modes. So we've got lectures, face-to-face, online, tutorials, or lectorials, where the two happen together. Yeah, in a variety of different ways of delivery. You're going to be engaging relevant theory and applying the science of best practice in order to, through authentic assessments, in order to develop your learning in public health throughout your course of study here. We liaise a lot with industry and to inform as well as liaise with researchers. Flinders is really blessed in this aspect that we actually bring researchers in to help deliver content as well and situate it and contextualize the theory that you've been learning. There's also a broad range of option topics available to you: the nutrition, public health, toxicology. New one this year: disaster management, environmental health, digital health, machine learning, and health ethics. So that's just some examples of that. Capstone topics will be happening for you later on in your course of study. That's the practicum or the dissertation. I'll talk more about that in a minute. So I just wanted to give you a look at what our programs, kind of how they articulate together. So you have the Master of Public Health. That is the general admission for 2 years or 1.5 years. And then you have your grad certs that are nested inside and articulate to the masters if you wish, or you can exit early and with a grad dip. This is another way of thinking about it. So you've got your postgrad certificate in public health that articulates with the NPH. So many of the same courses, just not all of topics, but not all of them. And so the grad cert in public health is 18 units. The grad cert in health promotion is also 18 units. And for the graduate diploma in public health, it's 36 units. You've seen this probably because it's taken straight from online. This is the study plan for the 2-year program. The practicum is on the left, and the dissertation pathway is on the right. Basically, you take one or the other. So coursework option is with practicum. Research option is with your dissertation. Okay, and that's the same thing, but for the advanced entry, which is 1.5 years, and so that's with students who have previous coursework that is credited towards the 2-year program. They can exit at 1.5 years. All right, so here we go. Capstone projects, topics, an important aspect is to actually apply what you're learning to the real world. So we have practicum. You need to have 54 units underneath your belt before you take that course. I actually teach it. I'm sorry, I keep on doing course and topic. Please don't get confused. I was working in a different university a year ago and they switched them. And so that's why I say it all the time. Please forgive me. So the practicum, we try to place, we have, in practicum, we place students in industry or in an education project. And industry includes outside of Flinders as well as within Flinders. We have a range of opportunities for you. Some people, South Australia Wellbeing, SA Wellbeing, Adelaide Primary Health Network, Cancer Council, Diabetes Australia, Samity Foundation, lots of different options for you, both community as well as the big public industry sites. For the dissertation, this is for 9512. This is really oriented for people who'd like to go on to a PhD and get an idea of what are some of the research skills you'll need underneath your belt to get started on that, and for you to investigate a line of inquiry that is yours or allied with somebody else's that you can actually be part of their program as well and kind of go forward on with your work in the PhD. So 54 units of credit you need to have that on board as well for 2 years, but 36 for 1.5 years, and you'll be working with a supervisor there. So what kind of employment opportunities? This is what I hear a lot from everyone as a course coordinator. They're worried about employment. Public health has so many different ways of articulating in society, from the policy level and all the way down to community. So here are some ideas for you. You've got academic and non-academic organizations, like I just mentioned for the practicum, but also occupations: research officer, project manager, data analyst. We've got, you'll be hearing from our team a little bit more about some of the things that we teach across these areas. Health promotion officer, clinical study coordinator, or PhD. And this is a time when I get to share with you from a wonderful team here. So first up is Dr. Cheryl Shellbach. She cannot be here today, but we're going to listen to her as she introduces something about herself. So let me do this. And hopefully the people online can hear this and see it. You should be able to see it. Hopefully we can hear it now. Great. So that was Cheryl. She's going to be teaching social determinants of health, as well as the critical perspectives and global health as well, which we're going to be hearing a little bit more about as well. But thank you from Cheryl, and we're going to go on to see if I can get. Oh, okay. Now, Kate is a colleague of mine, also teaching in second semester in the evaluation topic. She is not able to be here as well, but she has a lovely conversation for us to share a little bit about who she is, why she's here, and what her teaching is all about. Oh. Oops. Sorry, I didn't mean to touch something. But Kate was speaking quite profoundly and well about that. In fact, I think she needs to make a YouTube video of this. So I'm thankful to Kate for putting that very thoughtful, expose into who she is and why she does what she does. So now I get to invite Dr. Joshua Trigg up to talk a little bit. He's our newest member to our teaching staff, and we're a very warm welcome to Josh. Here is this. Thank you.
Hi, everybody. My name is Josh Trigg. I'm a behavioural scientist and population health researcher from a few different institutions. I've been at Flinders for about 2.5, bit more years now. I'm working predominantly on tobacco control, vaping, and risk factors for chronic disease. My contact with you will be if you're taking critical perspectives on public health and global development. So I'll be working with Cheryl, taking some of the tutes. And I look forward to speaking with you if that's the case. Where have I worked? So my background is in psychology of decision making and risk analysis. So I started off working in emergency management, looking at why people make certain decisions about life and death and injury in the face of bushfire and flood and things like that. So public safety, public health in that sense. And specifically, I looked at why people would make decisions based on the weight that they give to animal life versus human life. So that was the psychological aspect there. And then did a bunch of psychometric analyses to look at different clusters of people and how they would behave. After that, I worked in population health and cancer risk. So with Cancer Council SA, looking at why people drink, how they drink, smoke, expose themselves to the sun, those sorts of things. And in between there and coming here, I worked in occupational health. So looking at risk factors for cardiovascular disease in train drivers, which is a risk for them, not using the controls on a train properly and having accidents that are referred to as SPADs. And that can cause a bit of public harm. So basically the psychology of risk is my area. And I'm very also interested in health policy around tobacco control at the moment. So why do we let certain people smoke in certain areas? Companies and commercial actors do certain things, all that kind of upstream stuff that you were talking about before. And I'm interested in public health because, like everyone's saying, it's a very, very broad thing. So broad that some people don't have any idea what it actually refers to. So within that, you've got health economists, epidemiologists, statisticians, people who are excellent science communicators, people who work on the ground, clinician researchers, all sorts. So you can sort of make a fist of this and direct your interests however you like. I'm very interested in psychology of risk, so you might find something else is interesting to you. And yeah, that's pretty much me.
Thanks, Josh, for underlining the fact that this is your party. You can find out what's passionate for you, what you are passionate about, and follow it to wherever it leads. So that's really great. Thank you for that message. Now, Dr. Liz Buckley is going to come up and tell you a little bit about who she is. And yeah, great colleague of mine.
Thank you. Hello, I'm Dr. Liz Buckley. I'm a senior lecturer in public health. I teach into the master's program and I'm the topic coordinator for Introduction to Epidemiological Research. So I call myself an epidemiologist. I'm a researcher, lecturer. My main research interest is in cancer survivorship and the population health aspects of cancer survivorship. I love public health because I think the whole social justice, equitable health opportunities for everyone, that really resonates strongly with me. I don't have a lot of experience with health promotion, but I love how health promotion really empowers people to improve their own health. I think that's it's a really incredible thing that public health does. So I didn't start off in public health. I came to public health quite late in life. I started off, my undergraduate degree was in biomedical sciences. So I worked in research laboratories for quite a while at the bench. And then I I don't know, I had an epiphany. I saw the light, and I started studying public health as postgrad, and did a PhD in breast cancer screening. Yeah, I think it's probably enough from me right now. I think I look forward to meeting you all and working with you when you study epi research, introduction to epi research.
Thanks, Liz. Next up is Jackie Stevens. Dr. Jackie.
Hi everyone, I'm Jackie. I'm an Associate Professor of Public Health in Regulatory Science. What does that mean? Well, most of my work is around policy and looking at how data can inform policy and looking at a lot of work around guidelines and how health services work. So most of my work is around healthcare access and how people navigate the healthcare system to get the healthcare that they need, particularly people living in rural and remote locations. Everyone's spoken a little bit about what they did in the past and how they came to their role. I've been working in South Australia for about 20 years. I started off in a clinical setting, doing research at the bedside and in the surgical operating suite. And then I moved across into epidemiology during my PhD. So a lot of my research is looking at surgical intervention in the past. So if you look at what I've done my research in, a lot of it is to do with in the past cancer surgery, but more recently I've moved into ear, nose and throat surgery. So how children navigate the healthcare system to access ear surgery, because it's quite difficult for kids to get that surgery out in the country. And why do I do that? Partly because we have the worst ear and hearing health for our First Nations children in the world. So hearing health is a really big issue for our First Nations communities, and there's a large contingent of us working in that space across the country to try and remove that gap that exists. So some of the photos on the screen are me out on country where we do some of the data collection. I also work across the disaster preparedness space and how people access healthcare during disasters. But also I do a lot of work around how data is shared during emergencies between agencies. So we have NGOs, we also have the government, and how we can actually use that data that's collected and share it in a way that is safe for communities, but also helps inform how people can access the healthcare that they need. So there's some photos there at the top of me talking on the stage at a big international congress with members from WHO and the United Nations talking about data usage in emergency settings. So some of my work is also in that infectious diseases space, particularly given the recent pandemic. I teach the new topic, which is called Public Health, Climate Change and Disasters, which is quite a lot to get through in 12 weeks. So if anyone's doing that topic, it's going to be really fun. I've got lots of guest speakers. It's going to be quite a dense topic because there is a lot to kind of get through. So I'm really excited about teaching that topic. Thanks.
Fabulous, and great shout out to that new option topic. You know how to enroll. We already told you how to do that, right? Right. Okay. Thank you, Jackie. Wonderful. All right, so really quickly, Dr. Amy Hickman, many of you already know me. I'm a senior lecturer in public health, teaching specialist, also the MPH course coordinator. So a little bit about me. My background is in pediatric nursing. That was my first career. and then took kind of a left turn into thinking about the rhetorics of health and medicine, which is more in line with health communication. Really came out of my experience as a nurse and dealing with expertise of doctors and everyday ways of knowing from the patient side of things and understanding how the ways that they work together and the ways that they bump up against each other. And that was my dissertation. So I'm very interested in health promotion because that's kind of where all that stuff happens, with working between different kinds of expertise to kind of support community health and population health and well-being. Migrated to Australia about 11 years ago from the United States. And my family is all here, all out of home now in various parts. Megan's in Canberra, Sarah is still in Brisbane, my husband is in Brisbane, and I'm here. I go back and forth, so, but very much loving Adelaide at the moment. So I have a new family member, and that's my cockatiel. It's my emotional support cockatiel because I live alone now down here. And so if you are maybe in tutorials, you might be able to see and meet Charlie, who is my cockatiel. So yes, I'm interested in health communication, qualitative research methods, and community-based research. Also interested in reflexivity in teaching and learning, and have a research program in that at the moment. I'm excited because public health draws in so many different ways of knowing, being, and doing into its practice, and then goes out to support various ways of knowing, being, and doing about health and well-being, as you've heard from me before. So for the next couple of minutes, we have a really good, exciting end to our program because we have a special guest from International Student Services to speak to you a little bit about what they do. And we also have a wonderful representative from, actually the representative for student support and well-being here. So if I can ask Eduardo to come up, I'll go back to your slides. And it's getting big. Here we go. Thank you, Eduardo.
Thank you for all the amazing presentations. I feel pretty excited to be here, especially after everyone introduced themselves. My name is Eduardo, as Amy already said. I feel that after all the academics have introduced themselves, I might do a short introduction about myself. I am originally from Caracas, Venezuela. But I left my country pretty young, and I moved to the US, where I did my bachelor's of marketing there. And then from there, I moved to Australia, and I've been here since for over 12 years now. So obviously, I represent the International Student Services, or ISS in short. I'm one of the many international student advisors. There's about 5 or 6 of us now, and there's a dedicated person in the city as well. So I can relate to a lot of I've actually migrated to 2 different countries, so I can relate to, a lot of the struggles or challenges that can be present as an international student. So the good thing here about Flinders is that you actually have a dedicated service to support you and help you throughout your studies to succeed. There's many supports, and one of the main things we do is actually connect you with other support services. Something that we often say is that we are one of the main point of contacts for international students, because we might not always have all the answers, but can definitely point you to the right direction. Sometimes it can be a bit overwhelming. I'm sure you've seen some of the many support services that we have in the university, but it can be challenging sometimes knowing who to talk to or who the right person to reach out is. If you're ever unsure, you can reach out to us and we can help you. So look, here's a short slide of some of the things that we do. Obviously answer any general questions that you might have as an international student, share information with you. You can also book in an appointment with a international student advisor such as myself, if you want to discuss things in more of a confidential matter, and we can definitely help you with that. We also do a series of service for upcoming students, orientation. Hopefully you've all completed your FISO, which is the Flinders International Student Orientation. That is available on your flow page or Canvas, Flow, whatever we're calling it now. Flow, we'll keep it Flow. Good. And then we can also help you with some letters that you might need throughout your studies if you want to invite your family for graduation. So look, if you ever in doubt, you're not sure where to go or what's the right support service for you, ISS is probably a good place to start as an international student. Here are some of the FAQs that we get from students. I'm not going to go through them individually, but I just want to remind everyone that obviously while you're on a student visa, you have certain conditions that you have to meet. You'll be familiar with those. As I said, if you've particularly completed your FISO or your Flinders International Student Orientation on Flow, most of these questions, if not all of these questions, are answered thoroughly through the. But again, if you ever in doubt or unsure of your visa conditions, definitely we can help with that. Cool. Thank you very much, Amy. Appreciate it.
Okay, so there we go. And I'm inviting down now Mel to talk to us about Success and Wellbeing Advisors, a new position here at Flinders. So we're very grateful for you and the energy you bring to this. So thanks.
Thanks, Amy. Hello, everyone. We're online as well, aren't we? Yeah. Hello, online people. Can I just get a show of hands? How many of you are brand new to Flinders Uni? Okay, so some of you have studied here before, some of you haven't. Okay, so yes, I'm a Success and Wellbeing Advisor. I support the College of Medicine Public Health and the College of Nursing Health Sciences. My role is a bit like Eduardo's. It's kind of to be a bit of a conduit, a bit of a linking service into other services. So if you're feeling like things are not on track, you can come and have a chat with me. We understand, especially as master's students, I'm sure you have a lot of other things going on in your lives. I completed my master's over 5 years part-time while working full-time. I know what that pain is like. So when things start to get overwhelming, if you have caring responsibilities, if your car breaks down, if you lose your job, all those kinds of things, they do have an impact on your academics. You may try to just push through, head down and keep going, but I would encourage you to reach out to really anyone at the uni for help. I am one of those people. So if you're feeling like things are getting overwhelming, if you're feeling like things are starting to impact your academic success, I can sit with you, speak with you, we can talk about what your challenges are, and then we can work out a plan going forward. And most likely that'll be some referrals to some other services at uni. You might need some help with your academic writing. I'll send you to SLSS. You might need some help meeting and making friends. I'll probably suggest OASIS and ISS if you're an international student. There are a myriad of support services here at the uni that are all free. And so that's what I'm kind of here to do. The other thing I can do is I can kind of help you with a little bit of goal setting, time management, things like that. So if you're finding that you want to sit down and actually think about, well, what does this next 2 years or 1.5 years look like? What are my goals? What does success look like for me in the next 6 months? You can come and sit with me and we can try and map out maybe some goal setting strategies, some plans, maybe some project timelines, things like that. So I can help you with that. If I don't have the answer, we'll find it together as well. And then finally, this is a big place, lots of red tape, lots of bureaucracy, lots of processes, lots of things you need to do at particular times. So if you're having any trouble navigating through what is Flinders and its processes, then feel free to touch base with me and I'm happy to try and break it down. What I find with a lot of students is it all becomes too much and so you just ignore it and hope it goes away, and then it doesn't go away. And then at the end, it's way too late to fix it. So if you're feeling like that, and you're having trouble getting a process completed, then you can come and see me. My website's at the bottom. I'm sure that Amy will add it to your Flow page so you can access it. We have a straight-in booking system, so you can go on the website, you can click on the link, book straight in with me. I offer 30-minute appointments. I can do them on Teams, by phone or in person. Can do them at the hospital, up here on main campus, down at Sturt, wherever you happen to be. Yeah, hopefully you have a great 2 years and I don't actually need to see you because everything will run perfectly and you'll pass everything with flying colours. But failing that, I'm here to help, and yeah, don't be a stranger.
And one thing I'd like to sort of say, we're all about prevention here at Public Health. So don't wait until it's too late to see Mel. You see her, even if you don't think you need to see her, see her anyway. And that'll be good. All right, fantastic, fantastic. Well, I think this brings us to the end of our time together. I did want to ask if anyone had any questions. Oh my goodness. I'm not going to get to the question page, but does anyone have any questions? Okay. I don't know if Eduardo is going to stay around for just a minute or two if you'd like to have any questions to talk to Eduardo about. Yep. Oh, that'd be great. And that's okay. No worries. And I'm here if you guys wanted to have a chat with me. I'll be sticking around as well. Okay. And thank you all for your contributions to our orientation, Liz and Josh and everyone. So, all right. What do I do?